All right, before I go in with the patient, I'm just going to review her chart and see what type of dressing we're doing today and see when her last assessment was to see if there's any changes and make sure that everything is on track. So it looks like we're doing a wet to dry sterile dressing and I can see when her last assessment was, so I'm gonna go ahead and head in. Hi, Miss Jones. My name's Lisa. I'm your nurse today. I'm going to be taking care of you. I'm going to go ahead and shut these curtains to give you some privacy and wash my hands first, okay? All right, Miss Jones, can I take a look at your armband? Great. Can you just verify your name and date of birth for me? Fantastic. All right, Miss Jones, are you having any pain today? And if you are, could you rate that for me on a scale of 0 to 10, 10 being the worst, 0 being no pain? You're at a 3. Okay, great. Before I get started with pain medication, do you have any medication allergies that I should be aware of? No? All right. So do you think you need any medication before we get started on this dressing change? Are you okay if we get started? You're okay? All right, if anything changes with that, you just let me know. I'm gonna go ahead and get started, okay? I'm gonna raise your bed up so you're at a better level for me. And then I'm gonna raise my tray up here, okay? All right, I'm gonna start by cleaning off my table. All right, I'm gonna open up here. I'm gonna keep out 2 gauze and then put the rest in here. Open my still water. Are you having a good day today, Miss Jones? Yeah, great. All right. All right, I'm ready to begin. I'm gonna go ahead and pull down the blanket here and raise your gown if you're okay with that. All right, let me take a look. I'm gonna start by removing your dressing. If you have any discomfort that you can't handle, you just let me know, okay? All right, I'm gonna take the tape off on the sides, just rolling from the outside in, as to try my best not to hurt you, okay? All right, you've been through enough. All right, now that that's off, I'm gonna go ahead and take your dressing off and take a look, see if there's any drainage I should be concerned with. And so far, so good, okay? All right, before I take the dressing out of the center there, I'm just gonna use a little sterile water here, just to make it more comfortable for you so it's not sticking. Okay, all right. All right, looks nice and pink. I don't see any signs of infection right now, so I'm just gonna get it cleaned off, okay? Still doing okay? Great. All right, I'm just gonna get another piece of wet gauze, wring it out a little here, and I'm gonna wipe from the top down. Again, let me know if I'm hurting you at all, okay? Another piece of white gauze. All right, I'm gonna wipe one side here, flip over, wipe the other side. All right, everything looks great, nice and pink. You're doing great, you're doing a great job. Keep up the good work. Let me get a measurement here. All right, so I have 2.5 by 8. I'm just gonna see the depth here, centimeters, and then I have 2. All right, so now that you're all cleaned up and we have a measurement, I'm gonna go ahead and get redressed for you. Still doing okay? Great, all right. Get a little bit of white gauze here. Stick it in. Right here, great. Get the dry gauze up top. You're doing great. Another piece here. All right, I'm just going to tape that down for you, okay? I'm going to start tape one side, this side, and this side. All right, and since I like to take credit for my work, I'm going to go ahead and initial this here and put a date and time so we can alert the nurses when it was last changed and who did it, and that way we can keep track of how you're doing, okay? All right, let me get cleaned up. I'm going to go ahead and lower your bed down. All right. All right, so Miss Jones, if you need anything at all, your call light is over there. Can you go ahead and push that button for me just so I can make sure it's working okay? Great, it looks like it is. Okay, so if you need us, that's where you can, how you can get us. And if, otherwise we'll see you in a little bit, okay? Great. Clean up here, wash my hands, and I'm out.